I'm Tinabeth Pina. Today, we're focusing on science and pain. Science and You starts right now.
Hi, I'm Ernabel DeMillo. 3/4 of Americans take some kind of over-the-counter pain medication for relief. And while these medications are generally safe under recommended dosages, these pills can be toxic, even deadly. Well, coming up on Science and You, we're going to take a closer look at over-the-counter medications and how some scientists are working on relieving that pain.
I'm Mike Gilliam. Are you in pain? Have you tried everything the doctor can come up with and it still hasn't worked? Well, stick around. In just a minute, we'll show you some alternative forms of pain management. That's coming up on Science and You.
I'm Magalie Laguerre-Wilkinson. We all suffer from painful headaches from time to time. But what happens when the pain is just too much? Surprising help coming up on Science and You.
Hi, I'm Beth Kovetz. How do you prove something hurts? Advances in brain scanning are providing attorneys with proof of pain. Ahead on Science and You.
I'm Anne Riddell. Growing pains. Most of us have heard that term used to describe common childhood discomfort. But what are growing pains, and is it actually growth that causes them? Today you'll get some answers ahead on Science and You.
I'm Tinabeth Pina. What are labor pains? Well, most of them will tell you that it has absolutely nothing to do with our nation's lingering unemployment rates. That's ahead on Science and You.
Hi, I'm Ernabel DeMillo. If you have a headache or if you need relief from pain, you probably reach for some aspirin or Tylenol. And while these over-the-counter medications are generally safe, if not taken properly, you could end up here in the emergency room. Dr. Theodore Bania is an emergency room medicine attending and toxicologist at St. Luke's Roosevelt Hospital. He's seen his fair share of patients who have overdosed or have had a bad reaction to over-the-counter pain medication.
We see lots of cases of adverse reactions from these drugs or overdoses from these drugs. We'll see gastrointestinal bleeding or bleeding from the stomach from non-steroidals or people taking Motrin, Aleve, or Advil. And we'll also see liver toxicity from people taking extra Tylenol, and people may present with liver disease and liver failure from the Tylenol.
Aspirin, Tylenol, Advil, Bayer. These are just some of the popular pills found on drugstore or supermarket shelves. They are Americans' go-to pills for pain relief. No prescription needed.
They're sold over the counter, and you would think that they're safe. They're sold in large volumes too, usually large packages, but they can be very, very toxic if taken in overdose and taken in excess, and then even sometimes in therapeutic doses they can cause toxicity, especially if they're taken for a long period of time.
And maybe because these pills are so easily accessible, many people don't bother with reading labels. In fact, according to a recent report, only 1 in 5 people actually reads the directions on the label. But these pills are potentially toxic. According to the Federal Food and Drug Administration, acetaminophen, the main ingredient in Tylenol, is the leading cause of liver failure in the U.S.
The problem occurs when you take too much of it and your liver can't detoxify it. So it starts detoxifying it, but after about a day or day and a half, you run out of the detoxifying mechanisms within inside the liver can't detoxify it anymore, and then the Tylenol actually destroys the liver.
Dr. Bania added that many people also don't realize that acetaminophen is in prescription painkillers like Percocet and Vicodin. A recent study found that only 6% of people were aware of this. Taking Tylenol with Percocet is essentially double dosing and can be deadly. Meanwhile, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and aspirin can cause ulcers and gastrointestinal bleeding. But aspirin can also be a lifesaver. Studies from the 1980s have shown that an aspirin a day can cut the risk of stroke and heart attack. So what if scientists can figure out a way to make a safer aspirin? That's what's happening in this lab at the City College of New York.
So this is the compound. This could change the future of aspirin.
We hope so.
Dr. Khosrow Kashfi is leading a team of scientists who are working on a new aspirin compound called the Nosh aspirin. Not only is it safer than aspirin, they say, it can fight cancer.
We worked for a number of years on nitric oxide releasing NSAIDs and more recently on hydrogen sulfide releasing NSAIDs. Both of these have been shown to spare the GI from the toxicity of the NSAID per se. So they are safer on the stomach. So what we thought is that what would happen if we synthesized an NSAID that released both nitric oxide and hydrogen sulfide. And we have found that our Nosh aspirin in particular, we have other Nosh compounds, but the one that we have studied most extensively is Nosh aspirin, is safer on the stomach, and it is much more potent than aspirin in its anti-cancer activity.
In this image, you can see the Nosh aspirin in red. One arm releases nitric oxide, which helps protect the stomach lining. The other arm releases hydrogen sulfide, which enhances aspirin's cancer-fighting ability.
So this has the potential of being a super aspirin almost.
Well, you know, people, when they think of super aspirin, you know, Popeye comes to mind. I don't want to say it's a super aspirin, but it's an aspirin that has got enhanced activity and it's more potent.
And it will still relieve headaches and pain?
It should, yes.
In the meantime, while Dr. Kashfi and his team work on the Nosh, doctors and the FDA advise that consumers have to start taking over-the-counter medications more seriously. Read the labels. It could save a trip to the emergency room and maybe even save your life.
As for the Nosh aspirin, Dr. Kashfi says it's still years away before you can buy it in the stores. The next step is toxicity testing and then clinical trials. I'm Ernabel DeMillo for Science and You.
I'm Mike Gilliam for Science and You. Chronic pain, it can ruin your quality of life. So what do you do if you can't get relief through modern medicine? Well, a lot of people are turning to alternatives like acupuncture. That's what Suzanne Hill does. Let's take a look inside.
The needles I use are from Japan. I find that the Japanese have excellent quality of needles.
For 12 years, Suzanne Hill has been a licensed acupuncturist. She says she helps people get rid of pain when traditional treatments have failed.
Usually, I get the patients where it's not healed on the physical level because they've tried physical therapy or surgery or other methods, massage.
Hill leans towards acupuncture first.
Acupuncture is an energetic medicine, and just like your body has a circulatory system that conducts the flow of blood and a lymphatic system that conducts the flow of lymph, you have an energetic system that conducts the flow of energy in your body.
Tapping into that energy is a gift Hill says she's honed over time.
I can feel the energy. So when I put my hands on someone's body and I run my hands along their body, I can feel where the energy is flowing and where it's blocked. It can be blocked from a lot of things. It might feel like numbness. It might feel like an emptiness.
Sally Lynch had major back surgery that included the insertion of 2 long titanium rods and the fusing of vertebrae in her back. She lived with constant excruciating pain for years and even had been on morphine, but didn't want to live the rest of her life on drugs. So she says she went to clinics as far away as Switzerland looking for relief, but couldn't find it until she found Suzanne.
I was stuck.
Were you still in pain?
I was still in pain every day. Suzanne has changed my life.
But why and how does acupuncture work?
Acupuncture needles are made of stainless steel, and the metal conducts energy. So as soon as you put the needle into the body, it will open up the energy flow. And once the energy flow is open, it will manifest in opening up the flow of blood and lymph. And so toxins can be taken out and nutrition can be gotten to those cells, and that creates healing.
There are other alternatives out there as well. Dr. Laura Mantell is a medical doctor who also uses acupuncture as part of her practice, which includes lifestyle medicine and what are called mind-body medical approaches.
Mind-body medicine approaches are very effective. They are, you've heard of them, I'm sure, biofeedback and distraction, progressive muscle relaxation techniques, meditation. All of these practices really capitalize on the power of the imagination and also the power of the mind to help the body.
The idea being you can trick the mind into believing there is less pain, which allows the patient to do more and have a better quality of life. Mantell says it works. Both she and Suzanne Hill strongly believe in alternative forms of pain management.
You're a medical doctor, and you also use acupuncture. Why?
Because it works. You know, there are alternative medicines and there are complementary medicines, and there is a difference. We consider alternative medicines to be things that haven't been proven to work, but acupuncture's been proven to work. So I integrate it into my practice to help people with pain. It relaxes people, it de-stresses people, it doesn't do harm.
Now, we're not trying to steer you one way or another when it comes to alleviating your pain, but if you've gone the traditional route and it hasn't worked for you, a lot of people say you owe it to yourself to keep an open mind to alternative forms of pain management. I'm Mike Gilliam for Science and You.
I'm Magalie Laguerre-Wilkinson. Headache pain can spin us out of control, but knowing how to identify the type of headache can alleviate concern. But an unusual treatment might also help with the most severe of migraines, a treatment that can finally spell relief. Botox? It's not just for smoothing out those wrinkles. The news on that is that Botox has been shown to radically reduce the pain of severe headaches. So much so, it's now FDA approved. Dr. Julene Bryson is a neurologist from St. Luke's Roosevelt Hospital who specializes in the treatment of migraines. Her patient, Lori Edelman, has suffered with massive headaches for most of her life. On this day, they're so severe, she can't even stand too much light. The remedy?
I started Botox about 9 years ago. I get it every 3 months. It radically changed the quality of my life. I get far fewer headaches.
Is that the big surprise of Botox, is that it's a cure to migraines? Is it a cure for you?
Well, it's not a cure because I have to take other things also, but it's part of my preventative measures.
Regimen.
To make me have less, you know, so that I have 2 migraines a month instead of 20 migraines a month, because I need to work and have a life and have, you know, reasons to get up every day. And when you're in pain more days than you're not in pain, it's really hard to want to have anything in your life other than painkillers.
According to the National Headache Foundation, migraines affect more than 28 million people in the United States. 18% of women and 6% of men are known to suffer from migraines. Dr. Bryson is also quick to point out that Botox is not the first thing given to patients when they walk into her practice. In fact, it's the treatment of last resort.
What happens is, if someone has tried multiple medications and nothing is working, and they are left with debilitating headaches most of the days every month, that's when we try the Botox. Botox, when it works really well, still does not stop headaches. What it can do is reduce the headaches.
What are the scientific benefits of Botox?
Okay. So there's a lot of confusion when it comes to how Botox works. People think that it works by paralyzing the muscles because they think that they get a headache because they're frowning too much or they're too stressed, but that's actually not the way Botox works at all. So the way Botox works is it inhibits the release of these inflammatory proteins from nerve endings so that you can't get the inflammation, and the inflammation is what causes pain. Inflammation is very tricky because it doesn't just cause pain, but it can trigger another migraine. If there's a lot of inflammation, that will once again overactivate the brain, triggering another migraine. So Botox helps by stopping the pain at the source where it's being released on the forehead and in other parts of the head. And it also helps by not letting the inflammation perpetuate more migraines.
The recommendation is that migraines should be managed between attacks. Taking medication on schedule, eating regularly, staying hydrated, and exercising are all different ways to manage a migraine. And remember, as soon as there's even an inkling of pain, treatment should be sought out immediately. I'm Magalie Laguerre-Wilkinson for Science and You.
In a study comparing male and female skin, researchers found that on average, women had twice the number of nerve endings as men. 34 fibers per square centimeter for women to just 17 for men. So guys, when it comes to feeling pain, you don't know the half of it. Literally. I'm Beth Kovetz for Science and You. If I broke my leg, doctors could show you on an x-ray exactly where the break is, what kind of break it is, how severe it is. But up until now, doctors could never measure how much it hurt. But really, what is pain?
Pain is a brain-based phenomenon.
Pain is a feeling or is it a disease?
It's not either or. Pain, of course, is a feeling. We all know that feeling. What scientists are coming to recognize is that when it's chronic and when it's severe, it's much more than a feeling. Chronic severe pain is also a chronic disease.
If I'm in pain, how do I prove that?
Well, to prove it in a courtroom, you have to prove it to your physician. They don't see your pain, they don't feel your pain, but they believe your pain because they see your complaints. The advances in neuroscience now are taking it out of inference, but into objective confirmation by visualizing brain activity in brain structures that become active when a person's in pain. The main proof right now is what they call functional MRI. Functional MRI is not looking at the shape of the brain, but it's evaluating brain activity. And so they've mapped out parts of the brain that are associated with acute pain and with chronic severe pain. Severe chronic pain involves physical structures in the brain which also inflict a depression. It's a formidable predicament for anyone suffering that problem.
Is it fair to say that these advances in imaging have given scientists the ability to prove pain?
Increasingly so. These imaging advances and these scientific advances are equipping neuroscientists to confirm pain as a real thing, as an objective thing, and as a disease process in its own right.
So then the multi-million-dollar question is, how will proof of pain affect personal injury law?
The vast segment of personal injury cases concern the dispute as to whether the plaintiff's pain is real. And the mantra in most cases is that pain is subjective. So to the extent that you have scientific understandings and imaging advances that will now confirm pain, you have the potential to transform the justice system.
This has been Beth Kovetz for Science and You. Today, osteoarthritis affects almost 30 million adults in America. But it's been a pain in our necks all throughout history, and for that matter, prehistory. According to fossil records, our ancestors were still suffering from arthritis back in the Ice Age, over 10,000 years ago.
I'm Anne Riddell. Many of us remember as kids having that aching feeling in our legs. Maybe your parents said, as mine did, it's just growing pains. But what are growing pains, and how do we know the difference between normal childhood discomfort and something potentially more serious? As a little girl, Wendy Amstutz vividly remembers pain in her legs that would wake her up in the middle of the night.
I would call out and I would just say, "Mom, Mom, I'm in so much pain."
Many of us have heard of or even experienced growing pains, but how much do we know about what actually causes them? Dr. Thomas Lehman is the chief of pediatric rheumatology at the Hospital for Special Surgery.
True growing pains are pains that wake children up during the night, usually associated with periods of rapid growth and periods of great activity. They've never been fully explained. They're thought to relate to the fact that as the bones grow, the tendons stretch.
Dr. Lehman is also the author of the book, It's Not Just Growing Pains. He says parents need to understand what typical growing pain is and what it isn't.
Typical growing pains wake a child up in the middle of the night, but they're gone in the morning. They're not associated with any kind of disability. They're not associated with any abnormal lab tests. You want to make sure there's nothing else going on.
So what should parents be looking for? Dr. Lehman explains some of the symptoms that should be checked out and not just dismissed as growing pains. For example, pain during the day, stiffness when children get up in the morning, pain that is persistent, and pain in older children and teenagers, since growing pains generally occur at younger ages.
If your child has pain at night, but then they wake up and they're stiff in the morning, that can be real arthritis.
And we probably don't always associate arthritis with children.
True. Most people think children don't get arthritis, but in fact they do. They get very many different kinds of arthritis, many of which we can easily treat, but the key to all of that is early treatment prevents damage.
Wendy says for her, the pain was real, and she recalls her mother's words.
She would just come in and she would sit by the side of my bed and she would say, "These are growing pains," and mine were much worse.
Though growing pains are fairly common, the discomfort can feel intense for kids and be upsetting, so it's important to talk to them about what's happening. And of course, if you have questions, check in with your doctor. I'm Anne Riddell for Science and You.
I'm Tinabeth Pina. You hear the phrase labor pains quite a bit in the news lately because of our nation's economy. But for pregnant women, they take on a completely different meaning. So where did the term labor pains come from? And just how real and serious a pain is it?
I want the epidural. You said you didn't want it, and you said that even if you did ask for it, that would just be the crazy talk.
Gary, get me the juice! Pregnancy sucks. Making a human being is really hard.
In the movies, childbirth is usually absurd and unrealistic. But in real life, labor pains are nothing to laugh about.
Some people describe it as pain, and some people describe it as intense sensations. And some people describe it as both. But I think what's interesting about labor pain that makes it different from other kinds of pain is that it's a pain with a purpose. So the woman who is experiencing the pain knows why she's having the pain. So in that sense, it's a little bit less scary. And also, it's a pain that is coming from within herself.
Labor is well named. It's not easy. It's difficult. And it goes on for hours and hours. That's the problem. It's not a short-term thing with first babies. It can take the whole day and the night. So they need to be able to cope.
Coping with these real pains is key when it comes to getting through them.
In pregnancy, knowledge is power. So we encourage classes, we encourage partner participation, whether that partner is your mom or your husband or a boyfriend or even your sister. Any comfort, we call them comfort measures. They don't really get rid of the pain, they just help you cope with it.
Most people know that there are, pharmaceutical drugs, an epidural that can help women to alleviate their pain. A lot of the more holistic or the natural coping techniques that people use don't involve any drugs, and they don't necessarily completely take away the pain, but what they do is they help the woman to manage her pain and to feel like she can sort of cope with her pain. Some of the things that people do, some people will, use massage or counter pressure, on their back or on their hips. Some people will use mental strategies like counting or, relaxed breathing techniques. Some people will get in the bathtub or in the shower and use water to help alleviate their pain.
And some women will go as far as surgery to alleviate their labor pains.
Many women will ask for cesarean delivery as an elective procedure, not medically or obstetrically indicated, because they're afraid of labor. And when you explain that there's more pain potentially post-op, they don't care, they don't hear you. They don't want labor. The culture of fear is very great for labor.
But you can get through that fear and pain if you keep your options open.
The options are key. Movement is key, and being able to eat and drink. It felt very humane for people to let me keep gathering energy back because I'm not athletic whatsoever, but it's a very athletic event. This idea of this muscle continuing to flex and moving around a lot. I still felt like I'd run a marathon or maybe a triathlon.
Because we hear so many negative things about delivery. People tell you it's painful and it's going to be hell and it's going to, you're going to go through this and that. And only you know yourself and your body. And if you think positively, I think you'll have positive outcomes.
Be open-minded. Don't set up a goal like, I refuse, I'm not having anything, because then if you really need something, you're going to feel like you failed and you haven't even started yet.
The right method is whatever works for you. You know, having a baby is a crossing over for women. It's supposed to be a massive event, you know. Whatever you choose to do, it's a big job, you know, and it's meant to be really memorable.
Whatever path a woman chooses to alleviate her labor pains, one thing's for sure, they are not in her imagination. I'm Tinabeth Pina for Science and You.
Thanks for watching. See you next time on Science and You.